So there's several things that make our burn fellowship very unique when you compare it to other programs. So first of all, we do take care of adult and pediatric patients, first and foremost. The second thing, and very importantly, is with the mix of attendings or surgeons that we have here, we are actually able to provide care to our patients on the acute side, as well as the critical care, as well as a reconstructive care. And so, for example, all three of our surgeons are formally trained in burn surgery as well as critical care. In addition, one of our surgeons is actually a plastic surgeon as well. And so to have that dedicated, immersed burn plastic surgery component embedded within the fellowship, that's really a key advantage that fellows will enjoy because they really get that distinct exposure to that reconstructive care. There's a couple of other things that really make our program very unique. In addition to our unique care model, we are a very busy center, and so fellows will get a really great experience on the acute side, on the reconstructive side, as well as with laser surgery. We do a lot of laser cases, some of the highest volume in the United States, and so fellows will really get to enjoy that quite a bit. We're also very well supported in terms of our multidisciplinary team as well as our ancillary care team members. We're really well supported, and so it really gives the fellows a great opportunity to learn from other people, not just the surgeons, not just the nurses, but they have that opportunity to learn from therapists, from social workers, from case managers, and really not just making them a good surgeon, but really a well-rounded physician in general. So we take fellows from a variety of different backgrounds. We can take fellows who have graduated from general surgery or plastic surgery programs. We can take fellows who are in the middle of their general surgery or plastic surgery residency. So if they're taking a year off or a gap year or a research year, we can take them as well. In addition, one of the unique opportunities that we have is that we can actually open this up to foreign fellows as well. And so physicians who are fully trained in other countries who want to come here and learn how we take care of burn patients, this really is an excellent opportunity for them. Now, what kind of fellows really thrive here? Obviously, if you've graduated from a general surgery or plastic surgery residency program, those fellows enjoy a little bit of a more unique experience. And the reason I say that is because when they come here, they're not just a fellow. They actually come in with attending level privileges. And so as they move on throughout their fellowship, they are actually able to take call on their own, perform cases on their own, and in addition, we give them the opportunity to learn about the other aspects of medicine so they can run the team meetings. They can work with the team, they can lead the team, they can direct the team, and I think this is a crucial portion of their education. So depending on how you come here, if you're coming here as a graduate of a general surgery or plastic surgery program, or if you're coming in the middle of your residency program, you will have varying degrees of autonomy. Naturally, for those who have completed a general surgery or plastic surgery residency, they're going to come here with attending level privileges, and so they will get a little bit more autonomy. But one of the key aspects of the fellowship is to ensure that there is that appropriate transition and that appropriate balance from having a structured education program and structured mentoring or apprenticeship leading towards autonomy. And we believe that we have really kind of finessed that to a T. So when you first come here, sure, you're going to be supervised by attendings. You're going to have that supervision, that mentorship that you require in order to grow and to gain that experience and knowledge. However, over the course of the fellowship, you will have varying levels of autonomy as the fellowship moves on. And so by the time you finish from here, yes, absolutely, you're going to be able to do those complex cases on your own. You're going to be able to lead that team on your own. You're going to be able to participate and take care of that patient from the very start of their care to the very end of their care. So there was a couple of things that drew me to Akron Children's. Number one is just the culture here. With the hospital being a pediatric hospital and taking care of kids, it's just a different environment. It's a different vibe that you get just walking down the halls, the different attitude in a positive way that you get from people walking around and from family members and so on and so forth. It's unique for us because we do take care of adult and pediatric patients here. And so the idea to be able to take care of an adult in a pediatric hospital was indeed enticing. I had done it before at a previous employment, but it's just a different environment once again for those adult patients. I think they feel a little bit more relaxed, a little bit more comfortable. The environment is just a little bit more soothing for them. And I actually think that helps with their acute care as well as with their recovery. So I think there's a couple things that are very important when you're considering a program as a fellow. The first is environment. What kind of environment are you going to be working in? Is it a collegial environment or is it a non-collegial environment? We are family, and that's very important. With the 3 attendings, with our cadre of APPs, with the multidisciplinary team, we really are a family. You're going to get to know the team very well. You're going to get to work with that team very well. And as opposed to this idea where you're just working with a whole bunch of surgeons, because we're limited with just 3 surgeons, it's really more of an apprenticeship as opposed to kind of like a fellowship or a residency all over again. I think the other thing that stands out, and the other reason why fellows should come here, is again, you're going to get that breadth of cases. You're going to get the acute cases. You're going to get those reconstructive cases. Again, you're going to get that with a dedicated burn and plastic surgeon. That is something that the vast majority of centers throughout the United States, even throughout the world, cannot offer. And then in addition, you're going to get that exposure to laser cases. So you're going to have a great environment, number 1. Number 2, you're going to have great training. And then again, number 3, you're going to get exposed to all those other different aspects of medicine. You're going to leave here as a very competent burn surgeon as well as a very competent physician in general. I think graduates of this programs will have some great opportunities. Number 1, our commitment is that we're not going to necessarily just create a very good burn surgeon, but again, we're going to create an outstanding physician, because apart from the clinical side of things, so apart from that outpatient care, the inpatient care, the operative care, that clinical care in general, they're going to get exposed to a variety of different other aspects of medicine. Again, the administrative aspects, the academic aspects, quality improvement, research, verification, leadership, healthcare finances. These are all so very important, especially in this day and age. The fellows that graduate from this program will have exposure to all of those areas. And the key thing with that is that it prepares them for them to be able to go anywhere in the United States and serve or function as a very well qualified, very well-rounded, again, not just burn surgeon, but physician in general. So in addition to the clinical care and the administrative, training and education that you're going to get here, there are other aspects of this program that make it very unique and very attractive to fellows. In addition to that clinical care, there will be some exposure to research. So one of our physicians is also a dedicated surgeon scientist. And so fellows will actually get to participate in a number of research projects and/or quality improvement projects. That's going to be another advantage. In addition to exposure to that research and quality improvement aspect of burn care, which is very vital for a future burn surgeon, we also offer other opportunities that are kind of perks of the job. So number 1, we have a great graduate medical education program here. They have a lot of different fun activities and other things for the fellows to get involved with, including like a resident fellow council. The other nice thing is that we will cover expenses to attend the American Burn Association meeting. That gives the fellows an opportunity to immerse themselves in that world of burn care, meeting and an opportunity to meet other professionals from around the country, sometimes even around the world, at that meeting and be able to engage with them and learn from them as well. In addition, if fellows present or participate in any research, we will support their travel to go and present. It's very important and vital that if they do that work, if you do that research work and you get accepted to present somewhere, we need to help support you to enhance your academic career.